Let's talk about postural hypotension. What's the definition? What are the differentials? And how to treat postural hypotension? First of all, the definition. Postural hypotension is defined as a drop in the blood pressure, systolic, a drop of more than 20, and diastolic, a drop of more than 10, either one, in a person who stands from a supine position for 3 to 5 minutes. So we measure the blood pressure in the standing position after 3 to 5 minutes from lying down. So he lies down, he stands up for 3 to 5 minutes, and we measure in standing. And that is the definition of postural hypotension. 3 to 5 minutes is BP changes more than 20, fall more than 20, DBP falls more than 10, either one after 3 to 5 minutes of standing from a supine position or a lying position. Now, what are the differential diagnoses of postural hypotension? The commonest one is hypovolemia or dehydration. The drugs commonly implicated in the cause of postural hypotension are the AC inhibitors, nitrates used in cardiac patients, and even TCS. TCS cause postural hypotension. There are some diseases that causes autonomic neuropathy, such as diabetes mellitus, Parkinson's disease. They can also cause postural hypotension. And diseases associated with a fluid deficiency or fluid and electrolyte deficiency or loss of vascular tone can also cause postural hypotension, such as Addison disease, where we have deficiency of aldo, and that causes loss of fluid and electrolyte, so Addison disease. Sometimes pheochromocytoma may also cause postural hypotension, although it mainly causes the hypertensive crisis. But after the hypertensive crisis are over, then it leads to a postural hypotension. Now, let's talk about the treatment of postural hypotension, also known as the orthostatic. Some books mention that this is orthostatic hypertension, same thing. So the treatment for orthostatic hypertension depends if the patient has symptoms or not. If the patient has symptoms such as lightheadedness, weakness, then we have to start with the non-pharmacological measures. As the patient's commonest cause is drugs and hypovolemia, we have to withdraw any drug that may precipitating the condition. So stop drugs and use alternatives that is causing the postural hypotension. Correct hypovolemia. So ask the patient to take an increased amount of fluid and increased amount of salt. So take the patient to take fluids at regular interval. We can also ask the patient to drink caffeinated beverage, because caffeine has a positive impact on the vessel tone. It increases the vessel tone. Try to avoid any hot environment, because hot environment tend to cause vasodilation and venodilation. So that increases the risk of orthostatic hypotension. And in the early morning, limit activity. So in the early morning, don't work too much in the early morning. That can lead to postural hypotension. And don't work too much after eating. So we have to rest after eating. After eating, don't work too much, because that's one of the risk factors. And in some patients, we can also use compression stockings in the legs to improve the venous drainage. So we can use compression stockings. So those are the non-pharmacological measures that you can take to prevent or to relieve postural hypertension. And if those measures fail, then we have to go for the pharmacological measures. What are the pharm measures? And the pharm measures include some long-acting drugs and some short-acting drugs. The long-acting drugs are, first of all, drugs causing fluid retention and salt retention, such as fludrocortisone, which is a steroid hormone, fludrocortisone. We can also use erythropoietin if the patient is anemic. The short-acting measures include alpha-1 agonists such as midodrine, sympathetic agonists such as pseudoephedrine, another vasoconstrictor, and we can also use NSAIDs because NSAIDs leads to fluid retention, and that's known to cause hypertension. This is another cause of hypertension. So here we are using this side effect as a beneficial effect because NSAIDs is causing fluid retention and salt retention from the kidneys, and that's helping to maintain the volume, and that's relieving the postural hypotension.